Next we have Jin Leng from the University of Chicago, and he will talk about a pilot study of medical student knowledge in oncology and survivorship care.
Thank you so much, and thank you for having me. We're going to shift gear a little bit and talk about a medical education project that was done in Nigeria, a little bit different of a practice environment, and hopefully start some of the conversations around radiation oncology and medical education beyond the United States and the West. So we know that cancer is very prevalent in terms of disease, and it results in a tremendous amount of mortality. But what we might not be aware of is every year more people die from cancer than HIV, malaria, and TB combined, which are diseases we typically think of as diseases of the developing world. But already the burden of disease is shifting. And 70% of cancer deaths already occur in lower and middle income countries today. For pediatric cancer, this number is closer to 90%, where the majority of cases are not even diagnosed. Medical education in Nigeria has about a 50-year history. At the time, it was a colony of Britain, and it was modeled after the University of London at the time, with the first school established at the University of Ibadan, here in one of the red dots on the map here. It has an MBA system with an emphasis on tropical disease and pediatrics. And since then, medical schools have grown, and now there are about 28 accredited or partially accredited medical schools in Nigeria. The purpose of this study is to look at medical education that has been traditionally focused on tropical medicine and pediatrics and see if this curriculum is able to respond to the shifting burden of disease, as we have dealt very well with infectious diseases and as burden of disease shifts over to non-communicable diseases. So we conducted an anonymous survey at 2 medical schools in Nigeria, both in the southwest region. In the summer of 2017, we surveyed final year medical students who are about to move on from their careers to become practicing physicians. And we surveyed them on their demographics, their comfort level with different oncologic topics, and also included 5 clinical vignettes in this study. So here's some of the preliminary data that we have collected from this pilot study. As you can see, the median age is 24 years with an equal spread between males and females, and the 2 schools responded similarly. The response rate was about 36% across the cohort. And very few of the students have attended a tumor board, and it's good to mention that very few of these institutions have opportunities to attend tumor boards besides the private cancer centers. And about 17 people, or about 12%, intended to pursue oncology career, including radiation, surgical, or medical oncology. In comparison to the US data, that number is about 27%. And here are also some of the preliminary results for the students' exposure to some type of topics in medical radiation and surgical oncology throughout medical school. And a little bit different in Nigeria in these institutions. We actually find similar numbers of students exposed to medical radiation and surgical oncology. And I think that speaks to different practice environments where actually there's very little infrastructure for medical oncology in a lot of ways. And the surgical oncologists or the radiation oncologists are often the first point of contact in the oncology system. And looking at comfort levels on a Likert scale of between 1 to 5 as these students graduate medical school, we can see they're more moderately comfortable with most topics except for survivorship care. And I think that speaks to the fact that most of these patients don't make it to that stage of care. And as a result, many of the doctors are not familiar with how to care for patients that survive cancer. Of course, this is a very limited study, and very few studies have tried to assess the medical curriculum in Nigeria or other low and middle income countries in terms of looking at the shift between tropical diseases and diseases like cancer that have taken a bigger prevalence. I think this is one of the steps towards getting a better picture of what that curriculum looks like. And the next step is to survey these schools and to see what their curriculum looks like, what opportunities they have to do rotations in radiation, in surgical and medical oncology, and what students come away with that at the end of their education. because their education is quite different. Most students complete a 6-year degree, followed by 1 year of internship, followed by 1 year of required service to the country. And most people stop there and become generalists, and very few to go on to receive specialist training. So it's more important than ever to also train our generalists to be able to recognize issues related to oncology and to be able to triage patients appropriately. In terms of radiation oncology on a global scale, this is from another study that we did during the time that I was there, looking at the 8 machines that's available to serve the 190 million patients in Nigeria. At the time, only 3 were functional, and all of them were cobalt machines. And we see the catchment area of our study side. But we know that radiation is extremely indicated for cure in common malignancies worldwide. For example, cervical cancer, which remains the leading gynecological cancer worldwide, even though it's really decreasing in Western countries due to pap smears. And this, to be able to deliver this care, we need both a resource investment in education and technology. And of course, looking at radiation needs in low and middle income countries, this paper is from 2014, looking at the additional number of radiation oncologists, physicists, and techs needed by 2012, so in 6 years at that time, to serve the 84 countries that are considered lower and middle income. And we can see at that point, they're projected almost a doubling, for example, of radiation oncologists and tripling of physicists. And we're almost at 2020, and I don't think we're anywhere near those numbers. In terms of education, I think we really need to address this shifting burden of disease, which, if you look at this chart, only receives about 5% of funding in terms of care. So I think interdisciplinary care and education will be important as part of the developing healthcare system to be able to take care of these patients. Thank you so much.